These are two cases of abnormal ocular ultrasounds. This is the first one. This is the eye here, anterior chamber, posterior chamber right here. And you see this massive finding here that seems to be floating in the back of the eye. It's irregular. It's not a thin line like you normally see with retinal and vitreous detachments. This has thickness to it. It's kind of a triangular shape, and so that's why it's not a retinal detachment or a vitreous detachment. This actually turned out to be blood in the back of the eye. Also, retinal detachments most often, not always, will originate from the optic disc, which you see here, the optic nerve, and it does not originate from this area here and is coming more from the proximal portion of the eye. So the reason why you know, again, it's not a vitreous or retinal detachment, it's thick and it doesn't appear to be coming, and the reason why you don't think it's a retinal detachment is that it's not coming from the optic nerve, though again, I want to stress that doesn't happen all the time, but most of the time a retinal detachment will occur from this area. Case 2 is another patient who comes in for headaches and also visual disturbances. An ultrasound was done of the eye, and you can see that the optic nerve is pretty dilated. I think it's safe to say that if it's less than 5 millimeters or 0.5 centimeters, that there is no indication that there's increased ICP. Between 5 to 6 is very gray, and I don't think you can use that for clinical decision making. Over 0.6 centimeters or 6 millimeters is more concerning for increased ICP. And you can see in this patient that this is 0.7 centimeters, and this patient turned out to have intracranial hypertension or pseudotumor. If you play the clip, there's a couple things that you can tell. First off, as we said, the optic nerve looks dilated. And then you see this kind of outpouching into the vitreous humor from the optic nerve. It's kind of like a hump. And this is kind of a new technique. But in my experience, when I've seen a dilated optic nerve, you often do see this outpouching, which to me is more cupping of the optic nerve and is thus another sign of increased ICP, though that is not evidence-based. That's just me reviewing many of these ultrasounds and seeing that when you do have increased ICP, there is often an outpouching into the vitreous humor from the optic nerve.